Back now, recognize the gentleman from Georgia, Mr. Carter.
Thank you, Mr. Chairman, and thank all of you for being here. I'm pleased that two of my bills are included in today's hearing, the Improving Care in Rural Health in Rural America Reauthorization Act and the FDA Modernization Act. Improving rural health care is one of the top issues on my priority list. As we like to say in the state of Georgia, there are two Georgias. There's Atlanta and there's everywhere else, and I represent everywhere else. So it is important, particularly in rural South Georgia. And we know that rural communities have a lot of obstacles. We know that they have workforce problems. We know that they have distance and transportation issues. That's why the Improving Care in Rural America Reauthorization Act will reauthorize the rural health care services outreach programs. And those programs fund locally driven projects that focus on improving access to care and quality improvement and things that we want to improve on. Mr. Morris, let me ask you, many rural communities have higher rates of chronic diseases like diabetes and hypertension. What specific interventions funded through the outreach program have been most effective in reducing chronic diseases in rural areas? If you'll remember, when Secretary Kennedy took over at HHS, he made it clear, and he's made it clear ever since then, that he really wants to address chronic disease. It impacts over 26 million people in our country, and it's something that he has made as a priority, and we on this health subcommittee want to make it as a priority as well.
Thank you for the question, and thank you for your sponsorship of the reauthorization of this program. When we review the applicants for the program, it's a good indication of where the greatest needs are because the communities are able to identify what they want to work on and how they're going to address it. And so we do see a lot of our applicants coming in looking at chronic disease. I think the things we've seen that have been really effective over the years are early screening, so you can identify somebody who's at risk of a chronic disease and then getting them into a care plan. So a lot of our grantees include both screening programs and then care coordination as well. We see a lot of use of community health workers to help people, pay attention to their meds and keep track of what they need to do to manage their chronic disease. These grants also can provide, because they're essentially startup funding, they can also provide the initial salaries for a new doctor or a new nurse practitioner, and that can help get the project going as well. So
you do anything with diets? Because, we're known as the cardiac belt because of our diets, and we have such good food and such good cooks down south.
Yeah, I miss that food, sir, and but I take your point, and certainly I think I know of an example in your district in Baxley, Georgia, the Appling Partners in Health, and a big part of what they're doing is looking at how to train, teach people how to cook more healthy foods as a way to address, Yeah,
but it's not as good. I mean, it's just. Anyway, Dr. Corrigan-Curay, thank you, Mr. Morris. Dr. Corrigan-Curay, I appreciate the administration's focus on reducing animal testing and including FDA's roadmap to reducing animal testing in preclinical safety studies. We all know that millions of animals are being killed unnecessarily, and we want to do something about this. That's why I've introduced the FDA Modernization Act 3.0, which will allow for the development of safe and effective treatments and therapies without unnecessary animal suffering. We have a law for animal-free testing methods on the books, and it's time we put it to use by expanding testing options. When does the agency anticipate making updates to its recommendations or guidance on this matter?
Thank you for that question. We are committed to reducing and even eliminating, if we can, animal testing. We've been successful in certain areas. We don't test eye irritation or skin irritation with animals. And we will make sure that our guidances and our rules make it clear that we're open to companies coming in with these alternative methods. We had a very great meeting with NIH. Lots of science was discussed. And I think we're really on a good road to move forward in this area.
Good. Mr. Chairman, thank you, Dr. Corrigan. Mr. Chairman, I was very pleased to see a MUFA reauthorization on today's agenda, along with my FDA Modernization Act 3.0. One key tenet of the FDA Modernization Act are the provisions on non-animal testing methods for 505G are all monograph drugs. This will open the door for greater innovation and innovation products for consumers. I look forward, Mr. Chairman, working with you to include this language into the AMUFA. So thank you, and I'll yield back.